When researching shoulder electromyography during the overhead baseball pitch, there are 5 phases that occur with each throw, and each phase of the throw requires different activity from different muscles. So the first phase would be the wind-up phase. The main muscles that are in that are the upper trapezius, which is on the posterior side of your body, the serratus anterior, which is down here in your ribs kind of, and then the anterior deltoids, which takes place on this side of your humerus. The second phase would be the stride phase, which again has activity on the deltoids. The supraspinatus, which is inferior to the trapezius, but it's still on your back. Inferior to the supraspinatus is your infraspinatus, and then also includes the serratus anterior on the anterior side of your body, as well as the upper trapezius. The third phase would be the arm cocking phase, which would include the pectoralis major, which is on your chest, the anterior deltoid on your humerus, and also, quote, the supraspinatus, infraspinatus, teres minor, which is inferior to the infraspinatus, and the subscapularis, which is on the anterior side of your scapula. Quote, they are also at work to resist glenohumeral distraction and enhance glenohumeral stability, end quote. Escamilla and Andrews, 2009. The triceps brachii are also at use, which is right here, as well as your biceps, which is right here. And quote, they are both at work to provide additional stabilization. End quote, Escamilla and Andrews, 2009. The fourth phase is the arm acceleration phase, which includes the glenohumeral and scapular muscles, which would again be the subscapularis, the supraspinatus, infraspinatus, and the teres minor. The deltoids, which have moderate activity right there. There is high activity from the subscapularis, which is on the anterior side, the pectoralis major, which is on your chest, as well as the latissimus dorsi, which is right here. And then, quote, the teres minor and the infraspinatus and supraspinatus go from moderate to high activity, end quote, Escamilla and Andrews, 2009. The final phase would be the arm deceleration phase, which includes a lot of activity from the posterior shoulder musculature, which would be the infraspinatus on your back, the teres minor, which is inferior to that, as well as the major, the posterior deltoid, so back here, and the latissimus dorsi, which is right there. And then, quote, there is high activity from your rotator cuff and scapular muscles, which would be this anterior side, as well as the scapular muscles on the back side, on the posterior side on the scapula. When looking into the differences that I saw when comparing professional and amateur baseball pitchers, the main information I found out was, quote, when comparing professional and amateur baseball pitchers, it was demonstrated by Gowan and colleagues that subscapularis activity is nearly twice as great in professional pitchers compared with amateur pitchers during the arm cocking phase, which is phase 3, end quote, Escamilla and Andrews. And also, quote, rotator cuff and biceps brachii activity was 2 to 3 times higher in amateur pitchers compared to professional pitchers, end quote, Escamilla and Andrews, 2009. This one takes place in the arm acceleration phase, which is phase 4, when talking about the phases in the throw. Basically saying that professional pitchers have higher activity when looking into the subscapularis activity, whereas the amateur pitchers are more likely to have activity on the rotator cuff and biceps brachii, which would be on the more anterior side. The last part of this, how is the information in this article helpful for kinesiology professionals? I found that this information overall is very helpful to anyone, whether that's coaches, trainers, or any type of kinesiology professionals, because it can give them a lot of information as to what they need to do in terms of rehabilitation or anything if there is an injury regarded in that area. Quote, understanding when and how much shoulder muscles are active during upper extremity sports is helpful to physicians, therapists, trainers, and coaches in providing appropriate treatment, training, and rehabilitation protocols to these athletes. End quote, Escamilla and Andrews, 2009. Quote, as well as helping health professionals better understand the shoulder injury mechanism, end quote, Escamilla and Andrews. So overall, having this information can be helpful to pretty much every single kinesiology professional, because it doesn't hurt to get more information regarding the shoulder electromyography and how it can be helpful towards the athletes that do work with these muscles every day, and when it comes to injuries, it can help a lot with the treatment that they require, and the rehabilitation that might take place as well. Thank you.